This is a presentation from channel Dr. Ghosh Presents. Considering tonsillectomy, please check this video first. In our younger days, we all had suffered from tonsillitis more or less. In some cases, the situation might have gone so far that a tonsillectomy was done in one's case. Tonsil lies in our throat, that is known to many of us, but what is it? What are its functions? Is surgical operation of tonsil is desirable? Many have no definite ideas about this. Again, many say, I have no tonsil, but my sister has. This is a wrong idea altogether, because tonsil is an organ, we all have it. Possibly, the speaker wants to say that his sister used to suffer from tonsillitis, but he doesn't. Within our mouth cavity, at the base of the tongue, there are a type of lymphoid tissues arranged all around the inner throat, but are not visible generally. When they are infected, many of them swell up. Then we can see them as rosy red swollen tonsil on both sides of the throat. Look at the picture. On the left hand side, in the mouth cavity, nothing is seen because the tonsils are natural, so they are not swollen up. On the right hand side, the tonsils are infected, they have swollen up. Now we clearly see the tonsils rosy red with dots of white pus. But truly, they are of three types. Number one, palatine tonsils lie on two sides of throat. Number two, pharyngeal tonsils lie at the back of the throat. These are also known as adenoids. Number three, lingual tonsils lie at the base of the tongue. Generally, palatine tonsils are infected mostly and swell up to catch our attention. So these are called tonsils ordinarily. Tonsils are made up of lymphoid tissue which are part of lymphatic system of our body. This system is again a part of immune system of our body which guards our body day and night to protect from the damaging effect of different types of microbes as well as foreign bodies. On the right hand side, lymphatic system has been picture of lymphatic system has been shown. From above, see that the adenoids, tonsils, lymph glands, thymus, lymph vessels, spleen, Peyer's patch lying in the small intestine, bone marrow, etc. These are the parts of the lymphatic system. They actually guard our system against various types of infections and foreign bodies. Throat is the entry point of our digestive system and respiratory system. Lymphoid tissue situated there are the first layer of guards in our body. They catch the dangerous substances lying in the food and drinks and also in the inspiratory air. To fight against the toxins, they produce more tissues, so they swell up. The battle between them and foreign matters is manifested by various signs and symptoms like throat pain, earache, headache, feverish sensation, cough, weakness, trouble in sleep, etc. The dead cell resulting from the fight produce pus, which is often seen on tonsils as white patch or dots. How to manage the problem of repeated attack of tonsillitis? Each of us acquires disease discresias from families of both our parents, of which some remain active, some dormant. Thereafter to it are added environmental effects of person's own habits, the lifestyles, addictions, etc. etc. Thus, a person's own constitution is formed. Again, with time, this constitution changes, but a portion of it remains almost unchangeable, going through every aspect of the life of the person suffering from repeated attack of tonsillitis. We have to find out what is the trouble with him. If the problem lies with his personal life, then it is easy to rectify. For example, if he lacks nutrition, the same may be compensated. Else, if his addiction is the reason, he may be persuaded to stop it, etc. However, if the reason lies in this constitution inherited from parents, the same may be challenging to tackle with, but not impossible. Any system of treatment aiming to correct the constitution of a person can manage such a situation if the physician is sufficiently serious and diligent. What is a tonsil stone? In tonsil, there are numerous fine pores, canals, furrows. Food particles, saliva, bacteria, fungus, etc. accumulate there. Their interaction lead to formation of small bead-like hard substances. These are tonsil stones or tonsillolith. Look on the right hand side. On both sides of the tonsils, white small bead-like substances are seen. These are called tonsil stone. How tonsil stones are treated? There are a lot of homely treatment for tonsil stones. Most of them are very effective, but everything depends on the status of the patient. If homely treatment doesn't respond, patient do not get relief, then doctor's intervention is imperative. Below, a few homely treatments are referred to. Number 1. If the stone is small, tucked on the surface, and the place is reachable, then with the help of a piece of sterilized gauze between two fingers, the same can be mopped off. Thereafter, throat should be gargled with warm saline water. Number 2. Sometimes simply gargling with warm saline water may extract out small stones. Number 3. Sauerkraut, apple, onion, carrot, garlic, etc. help in bringing out stones. Number 4. Mixing drinking water and apple cider vinegar or simple vinegar in 5:1 ratio. If gargling can be done regularly, stones are reported to erode out completely. 5. Sometimes simple coughing or hawking throat helps to stones out. When tonsillectomy becomes imperative. Modern medicine says when a person suffers from tonsillitis again and again, no medicine gives tangible effect. Repeated dyspnea, apnea, deep tissue inflammation, nose block for many days, pain in abdomen, vomiting, etc. etc. make the life hell, then tonsillectomy is indicated. But to avoid trouble of conservative treatment, many a person adopt tonsillectomy at the first chance. An operation of tonsillectomy is being demonstrated. In my personal experience, I noted that a lot of chronic tonsillitis to get cured completely with biochemic medicines applied in proper doses and repetitions for a long time. These medicines have got an edge over others since they are tissue salt, they have very little side effects. A request to viewers, readers and listeners, please give a consideration to this fact before adopting tonsillectomy. How much rational is tonsillectomy? Many big think tanks of medicine think that tonsils are our first line of defense and remain active till late age. As such, this should not be operated out. In that case, toxins and microbes can directly enter our system without any resistance. No warning signal of infection would be there. Look at left figure first is the digestive system. The digestion starts from the mouth, and there at the base of the tongue lies the tonsil. On the right hand side, the respiratory system. This also, around throat, the same tonsil guard this system too. So if tonsils are removed, both the systems are devoid of first hand guard the infections or any toxins from outside will directly enter into the system, I mean in the lung or in the stomach.
Get an example. Suppose you keep a doorkeeper for safety of your house. Whenever some danger appears, the doorkeeper himself at once pounces on it. At the same time, he raises such a hue and cry that all persons of the house wake up. Such incident happens often.
Under such a situation, if to avoid persons waking up from sleep, you drive the doorkeeper out, is the action appears sensible? The duty of the first line of defense is to raise alarm when trouble appears. Tonsils are the doorkeeper and our body is the house. Now you take the decision whether you go for tonsillectomy. Our present session ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added or what should not have been added. I will be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.